we're back. It's time for our Africa Health Network update.
And health reporter Linord Moudou joins us now. Hello, Lino.
Hey, Lino.
Hello, Vincent. Hello, everyone. The World Health Organization says cervical cancer is the second most common cancer in women worldwide. It is also most prevalent in developing countries. The World Health Organization says about 500,000 women worldwide are affected by cervical cancer each year. 80% of the afflicted live in developing countries, in particular sub-Saharan Africa. Professor Grosbeck Parham, co-director of the Cervical Cancer Program Prevention in Zambia, talks about the deadly disease.
Cervical cancer is a major killer of women in the developing world, particularly on the African continent. Of all the cancers that affect women, cervical cancer has the highest mortality rates.
Professor Parham says the rate of invasive cervical cancer is high among women in sub-Saharan Africa due to the lack of screening programs. Akorede Teresa just received a free cervical cancer screening at the George Carey Life Foundation in Lagos, Nigeria. She says she understands that early detection is important.
I've been hearing from people that cancer is a very bad disease that causes some bad life to human being. So it is good to check up and know whether you have it or not, so that the earlier, the better you treat yourself for it.
Unlike Teresa, many African women do not get screened for cervical cancer. Sometimes it's due to ignorance, and other times it's because they do not have access to a screening facility. The Pap smear, one of the most widely used tests to detect potentially precancerous and cancerous cells in the cervix, is still not accessible to many women. It is often not available or too costly. Professor Parham says another challenge in addressing cervical cancer is HIV/AIDS.
Women who are infected with HIV have higher death rates from cervical cancer. They have a higher incidence of cervical cancer. It's more frequent and it is more difficult to cure, and it appears that it grows much more rapidly.
Cervical cancer is a cancer that starts in the cervix, the lower narrow end of the uterus. The human papillomavirus, HPV, is the main cause of the disease. Experts say HPV is a common virus that is passed person to person during intercourse. Experts say women with cervical cancer can be treated and their lives can be saved if the disease is detected early.
Cervical cancer can be prevented because it has several phases that it goes through before it becomes a real cancer. The most important phase is what we call the precancerous phase, when the abnormalities are sitting right on the surface of the cervix and haven't grown down into the deep tissues. The cure rate of that phase of cervical cancer is almost 100% with a small local procedure that can be taken care of in any gynecologist's office.
For more than 10 years, the international nonprofit organization JPIGO, an affiliate of Johns Hopkins University, has been working with developing countries worldwide to provide them with low-cost solutions to address cervical cancer. I spoke with Dr. John Varallo, Senior Technical Advisor at JPIGO, about the organization's unique approach to prevent the disease.
If you take the general population, a single screening at, say, in the mid-30s or at age 35 can reduce the risk of cervical cancer by about 25 to 30%. Okay? And most of the programs that we're establishing were recommending screening intervals, a frequency of about 5 years. Okay? But for HIV-infected women, we're recommending yearly screening.
Traditionally, what is known, at least in the West, is the Pap smear test. I know it's available in some developing countries, but some women complain about the cost. In some places, it's not even there.
Well, those are exactly the points that the problem is with the Pap smear. It is used a lot in the West or in more developed countries, but the cost issue and the logistics associated with it make it impractical in lower resource settings. And because it's a multi-step process and it's expensive. So what JPIGO has been a champion for is a more simple, low-cost, safe and effective and highly acceptable screening procedure, and that's the VIA, or visual inspection with acetic acid. And acetic acid is just simple white table vinegar. And in that process, the examination is essentially the same as far as visualizing the cervix, but you just wash the cervix with the vinegar, with a cotton swab, wash it. A normal, healthy cervix starts off looking pink and stays pink after putting the vinegar on. Any abnormal cells, in about a minute, will change to whitish. And most women are going to be normal or VIA negative. About 10% or so, maybe a little bit lower, a little bit higher in a general population will be VIA positive. In HIV positive woman, the rates are higher. They can be twice and sometimes even 3 times higher than the general population. But at that same visit, woman doesn't even get off the examination table. We can go ahead and do the freezing or the cryotherapy right then and there. You don't need anesthesia, minimal discomfort associated with it. It takes a total of about 10, 12 minutes. This is the cryotherapy unit. This portion actually hooks up to a tank of gas, and it's carbon dioxide gas or nitrous oxide gas. The gas comes through here and causes freezing here. This is the cervix, okay? It has a little white lesion on there. What you do with this, it's the same speculum exam, is that the cryotip is put on like that, okay? So it covers the lesion, okay? And then you click, start the freezing. That goes for 3 minutes, and then an ice ball will form around the tip there. So like a white ice ball. Then you defrost, you come off, you wait 5 minutes, do the second freeze, same thing, get the ice ball again, defrost, and then you're done. And that's exactly what it looks like after the freezing.
Now, does it stay frozen like that?
It does defrost. And so this actually shows about 1 hour after.
Okay.
Following that is the biggest kind of side effect from the cryotherapy, besides a little bit of cramping initially, is that there will be a watery discharge, clear watery discharge. And that can be for about 4 to 6 weeks. And that's the cervix healing itself. It's actually getting rid of the bad cells, so it's kind of cleaning that out for about that time frame. So one of the important things that we counsel about for proper healing is that no intercourse for about 4 to 6 weeks following that. And so it is really important that we try to have the men involved. They should be aware of what's happening with their wife or with their partners, and support them. Sometimes the issue that we will run into is that a husband will not want to abstain from intercourse. If they can abstain, then we recommend using condoms to reduce the risk of infection following the treatment.
Okay. What about the cure rate for a woman that is not HIV positive?
We re-examine that woman in 1 year.
Okay.
And what we're finding in our programs is that we have about a 95% cure rate at 1 year following the cryotherapy, which is very good. You've seen in the literature before was maybe about 85% or 90%, but what we're using is strict criteria for women who are eligible to have cryotherapy, meaning that the lesion has to be small enough. It can't be too large because the probe of the cryotip has to fit over that precancer lesion in order for it to be effective.
What about a woman with HIV positive? Is it going to be the same rate as a woman with HIV negative?
Yeah, that's a really good question, and that's what we're following right now. There's another type of procedure called LEAP, which is loop electrosurgical excision procedure, which is a little bit more detailed, uses a wire loop to cut out the abnormal area. And even with that, and with the cryotherapy, we're finding that the cure rates are actually a bit lower with HIV positive women. So it is even more important that they do come back at the 1 year follow-up to ensure that everything is good.
And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website at africahealthnetwork.com. Vincent, back to you.
Well, really excellent report, Linord, there. Thanks a lot. Be sure to watch Linord Moudou's Africa Health Network reports every Tuesday and Thursday right here on In Focus.